Good day, everyone. I'm David, moderator for this webinar, and I welcome everyone for today's webinar, which is the CMS Hospital Infection Prevention, Control and Antibiotic Stewardship Program, CMS Compliance Requirements for 2023. I would now like to introduce our presenter for today, Laura Dixon. Laura Dixon, BSJD-RN, CPH-RN, was COPICS, Director of Facility Patient Safety and Risk Management and Operation from 2014 to 2020. I would now like to hand over the floor to the speaker. Over to you, Laura.
Okay, thank you very much and welcome everyone. As David mentioned, what we're talking about today is infection prevention and control and antibiotic stewardship program. There have been some really recent changes and some new ones that are also coming up. Deficiencies. I mentioned that we don't ever want to get that list of deficiencies. Well, we now have access to it. Well, let's hit the meat of the program, and that's our infection prevention. Back in 2019, CMS put together two rules. There was one called the Improvement in Patient Care Rule. It was very long. It went into effect in November of 2019. But the problem was what they talked about, infection prevention and control. And yes, this is the same slide I showed you before. But what your program has to show is you're sticking with national guidelines on infection control. The guidelines, these are pretty much some new ones. You have to have an active infection control program. And that's throughout the hospital, whether it's ED or nursery. Overall, your programs have to be based on your own hospital's assessment. I put in here, when applicable, what the surveyor is going to do once they're on site. So what do you want to look at? All right? How big are you? What's your patient census? What's the characteristics of your patients? How many services? How complex are they? Are you a general medical surgical hospital? The surveyor is going to make sure this person was appointed by the board based on the recommendations of medical and nursing leadership. They want to make sure that your program includes surveillance, prevention, and control. The guidelines here say you have to have and maintain a clean and sanitary environment so we don't pass these infections back and forth. Look at your monitoring of your housekeeping maintenance. Water management is big with CMS because of the outbreak of Legionella. It is still around. Again, all infections that meet the specified criteria for reporting and what CMS requires for your incentive payment have to be reported. They use this data to track hospital-acquired infections, healthcare acquired infections. So the antibiotic stewardship program, this is one that really has a lot of special challenges for our facilities. The leadership, what you have to do is make sure this person is qualified. Now, this person doesn't act in a vacuum. They have to have staff to help them. How many? CMS won't tell you. How many hours they dedicate? Same thing. That's up to you. You have to have policies for your antibiotic stewardship. Your ASP program also has to show coordination amongst components of the hospital. We're trying to improve our antibiotic prescribing. CDC and CMS has that interoperability program. They talk about electronic reporting for payment adjustments. Next tag number talks about documentation. That the hospital-wide program documents what they've done. Also that the program adheres to guidelines from your national experts. Leadership has a lot to do with this, and I'm talking just the C-suite. We're talking the governing body overall. Your policies should address, and that's what the board has to make sure of, that the roles and responsibility of prevention and control are within the hospital. The policies on an antibiotic stewardship program, as far as QAPI leadership, the board has to make sure that all healthcare-acquired infections and other things brought in are addressed through the program and antibiotic use. Specific duties, QAPI and training programs have to be involved in addressing problems. On education recommendations, who should have it? At this point, CMS switches over now to the preventionist. What are their responsibilities? This preventionist also has to work with others, so there has to be communication and collaboration. The preventionist has to give also training and education to everybody. The preventionist also has to do auditing and communication with other programs. CMS next addresses the antibiotic stewardship program and the leader of such. They have to ensure there's appropriate use of antibiotics. There's additional responsibilities. They, like the preventionist, I'm going to talk briefly about a unified integrated program. So as far as in a unified integrated program, you can do it. These are multi-hospital systems, but each hospital has to be separately certified. Each hospital is responsible and accountable to the governing body. Any policy and procedures that are in place have to take into account, like everything else, you have to have someone who's qualified with expertise. I want to switch to Joint Commission, and particularly those who have deemed status. It's here as a reference only. and to assist with what CMS does have. Medication management. They've updated this chapter as of this year, July of this year. Now there's multiple resources. All right, let's talk CDC, infection control, the resources. There's a whole bunch in here because of what's required. Well, CDC has information for your professionals. STRIVE program. This was developed by infection preventionists. They've updated infection control and healthcare personnel, the guidelines for those. I'm going to switch over now to CDC, talking about their antibiotic stewardship programs and core elements. They updated them in November of 19. Well, let's talk about just briefly some memos on infection control. There is a memo on safe injection practices. So for single-dose vials, all entries, if you're going to do this, when you do it, you have to use it within 6 hours of initial puncture. If you are using a compounding vendor, your pharmacist needs to have a copy of this memo. They probably do, but just make sure they have a copy of it. Another memo that came out was on breaches. Boy, these continue, unfortunately. So reusing a needle or syringe that's already been used to give medication. Talk briefly about Legionella and your waterborne pathogen. It is still a problem. It occurs in systems that are continuously wet. Other issues that address CMS, ISMP, Institute for Safe Medication Practices. They talk about IV push medications. You shouldn't have to combine medicines into a single vial, or a single syringe. CDC gave us vaccines. Now I've included all this because it all has to do with infection prevention. We talk about vaccine storage and handling. Cold chain is the temperature controlled environment so that the vaccine stays at an optimal. And then other infection control, I want to talk about some updates on cleaning procedures. So again, CDC put out the health update. And of course, it's different between critical and semi-critical. We know the critical are your surgical instruments. With what's left, I am going through the infection control worksheet. This is no longer utilized. There's 3 worksheets overall. CMS put these into place when they were working on the hospital improvement rule. What about post-exposure for your staff? Respiratory protection program, vaccination and documentation, even have a hand hygiene tracer. This is to be followed on all units. There has to be soap, water, sink. Multi-dose files, are they dated when opened? And they even talk about linen and laundry services. I want to point out there was a memo that came out earlier this year, and it talked about ethylene oxide inhalation, central venous line tracers, sterile water or salines for nebulization. How is the surgical attire? CMS is really, they really focused on infection prevention and control with COVID and then some of the other recent outbreaks that have been going on. So with that, thank you, David. Thank you for your assistance, and thank you for everyone who listened into today's program.
Thank you, Laura. That does conclude the session for today. And thank you, everyone, for participating. You may all disconnect now and have a great day ahead.